Okay, our guest today is Brian Enis, who's the Chief Operating Officer of Ascentium Healthcare Resources based in Magee, Mississippi. Welcome, Brian, and please tell us a little bit about yourself and how you got to this point in life.
Good afternoon, Alan. Yeah, I guess I grew up in Brandon, Mississippi. It's kind of started out in the PT world. Managed a PT clinic in Flowood for about 15 years. We had a small billing company as well within that PT clinic. So I worked there, 15 years. Came to work in Magee for a company called Pioneer Health Services back in 2015, early 2015. Worked here. I was the director of clinical operations. We had, clinics in Georgia, Tennessee, North Carolina, Virginia, all over. Left there and went to work for on the payer side at a company called Magnolia Health Plan in Jackson. Stayed there for a little while. Then here I am at Ascentium. Sidney Sawyer, our CEO, called me up, and we talked a few times, and he got me back in Magee. A good friend of mine that I met, back in 15 at Pioneer, and it's been a pleasure to work for him since.
Great, good to hear. Well, tell us a little bit now about Ascentium, when the company was founded and what your mission is, and just kind of give us a good overview of the company.
It started in January of 18. We basically bought a company that went out of business, bought the billing and collections contracts from that company back in December of 17, and opened up in January of 18. I came here in February as the Chief Operating Officer. We do basically revenue cycle management for medical groups, hospitals, clinics, and such. We also offer, operational resources such as provider enrollment, service line additions, strategic planning, 340B programs, things like that. Basically billing and collections with some operational resources thrown in there.
Okay.
As far as our mission, to contribute to the financial well-being and success of rural healthcare facilities by providing superior support and resources. That's, in a nutshell, our mission statement.
Great. Okay. What do you see, Brian, as the key needs and challenges in Mississippi healthcare today?
Access. We do a lot of work with rural health clinics and critical access hospitals, and they're out in the tip of counties or the Leake counties or Scott County, Mississippi, and people don't have a lot of access to quality health care in those areas, and we need to keep those hospitals in business. I mean, we need to get the community's got to support them, and that's generally where we get all our business from, is these rural areas that's so important to communities in Mississippi.
Mm-hmm. Okay. I know from experience myself that there is a tremendous need for rural health care in the state, and I've written about it through the years, and there's a lot of tragedy out there, and there's definitely the need, isn't there?
I mean, Mississippi's a rural state. The hospitals within those communities are a staple, and they're just vitally important. I mean, everybody in these areas don't have access to go to Jackson or Hattiesburg or Tupelo or wherever to get services, and these community hospitals are hugely important to the area.
In a real way, you see yourself as a kind of partner with some of these rural healthcare facilities. Is that correct?
We are. That's what we consider ourselves doing. We partner with them. I mean, we bill and collect for them. I mean, these hospitals, clinics, and such, they provide quality care, and we make sure that the Blue Crosses of the world and the Medicare and Medicaid, pay them for the services they do, and there's nothing wrong with that. It's the cash flow is very important to every part of a of a hospital or a clinic or medical group. There's no denying that. So we partner with them and do the best we can to get every dime we can in the door for them.
Very important. So tell me, how does someone learn more about Ascentium and what you do and all of that?
You can call us up 601-849-6440, or you can get on our website at www.ascentiumhcr.com, and that's ASCENTIUMHCR.com.
Okay, very good. All right. Well, you've been very helpful today. We will look forward to seeing how your company grows and progresses and provides solutions for some much needed problems in our state.
Yes, sir. Thank you for the time.
All right. Thanks very much, and you have a good one.
You too, sir.